Hi, thank you for participating in ACP's Wellness Wave, brought to you by ACP Southern California Region 3. My name is Alex Malouf, and today I am so excited to interview Dr. Middleton. Hi, Dr. Middleton. How are you doing this morning?
Great, thanks. Nice to be here.
Nice to have you. Can you tell our audience a little bit about yourself and what you do?
So I am a rheumatologist at UC San Diego, but I actually work in the orthopedics department, and I specialize in patients with osteoarthritis.
Well, that is excellent. How did you choose your career path in medicine?
So for me, I decided on rheumatology actually as a fourth-year medical student. It was the first rotation that I did my fourth year, and it was instant love. And I never changed my mind for medicine residency and then rheumatology. Where things kind of got different was after that. My path has been not the one that I expected. I did a lot of research when I was a fellow, but decided what I really liked was seeing patients. So I decided not to stay in academics and took a job in private practice in Texas, which I really enjoyed. But things outside of work weren't ideal for my family. So then I moved to Las Vegas and took a job in a staff model HMO. There, I wasn't planning on it, but I got involved in management. It was a very large organization. I really enjoyed quality improvement projects. I enjoyed building and growing departments and hiring people. And then ultimately that job changed where it was not what it was when I started, and I made another change. And that's how I got to my present job in academics. The rheumatology and orthopedics departments here, we're looking to have a rheumatologist work within orthopedics to kind of combine the two mindsets. And when I was at my previous job, I had taken care of a lot of patients with osteoarthritis, found out I really enjoyed it a lot. And so this job was very appealing to me. Patients with osteoarthritis oftentimes have a lot of not very good information and about their disease, and I think it's very rewarding being able to teach them and help them do well with their disease. The other thing that supported me here is I found out I really love teaching. It's a lot of fun and rewarding. And I've gotten very involved with the medical school here and the admissions process. I've been on the admissions committee for a long time. Those are things I didn't think I would be doing, but again, things change, and you have to be open to that, and it can really work out for the best.
Well, thank you so much for sharing. I think a lot of the key points I gathered from your discussion right now is the importance of being adaptable in medicine, and that will help you find your way sometimes to where you're best suited. And I can also corroborate as your student that you're just an excellent teacher. So I'm glad you found your niche.
Thank you. I think one of the things it's saying, and this is a wellness aspect of it, is it's good to get involved in something you enjoy outside of direct patient care. For me, in my previous job, it was the management, the quality improvement part of things. Presently, it's teaching and the medical school things I'm involved with, but it helps give you balance if you and kind of break up the patient care. And I think that helps make our jobs in medicine easier if you have other things outside of patient care that can give you that balance.
That is so true and so important for us to remember moving forward. And for medical students and residents who are still pluripotent and still trying to figure out their career path, and it's not very well defined at this point, what advice do you have for them?
Get as much experience as possible. Try out different things. Try things that may be a little bit outside of your comfort zone, because you may be surprised. You really like them. The more experiences you get, make sure you get some experiences in the outpatient world, not just the inpatient world, so you can understand what those opportunities are. But the more you expose yourself to, the more likely something is to click for you. And then ultimately, trust your heart. Don't necessarily overthink it. Go with what feels right.
Yes, and I know I've heard you tell me go with your gut and what you think is best. So I think that's very wise advice. And now I want to shift gears and talk about a wellness question that I think is very important to all of us. And the question is, what advice do you have for medical students and residents for dealing with medical mistakes and setbacks?
We can't be perfect as much as we would want ourselves to be. There are going to be times where your patient doesn't do well. There are going to be times where the treatment that you have proposed doesn't work out. There's a complication or side effect that affects the patient. There are times when a patient's going to be mad at you that you didn't meet their expectations for whatever reason. And those are all hard on us. We have a hard time with that. The first thing I think you have to do is ask yourself, what could I have done differently? What can I learn from this going forward that I might do differently next time? And as soon as you have an answer to that question, and it may be nothing, or it may be there's some valuable lessons there, but as soon as you have that answer, then forget about it. This is where you have to be a goldfish. It's a quote from Ted Lasso on Apple TV. What's the happiest animal in the world? It's a goldfish, because they only have a 10-second memory. And so they forget about all the bad things. Now, I think biologically, unfortunately, that's probably not true. I think goldfish do have longer memories, but the principle still applies. I think once a bad thing happens, and once you've learned from it what you can learn from it, you need to put it out of your mind. You need to forget about it, and you need to move on. I had an example of a few weeks ago, where in the same week, I had a patient who was very unhappy with what I had done for them. And then that same week, I had another patient tell me that it's the first time they've ever felt comfortable with a doctor. And you have to really focus on the good things that you accomplish. Those you should remember. And when you have a bad day, pull those positive feedbacks back out and remember them, and realize you are making a big difference for people. And try to keep those as the important things that you're thinking about. And the last thing I'd like to add is treat yourself with the same empathy you treat your patients. So respect yourself and understand that it's not always easy, and help yourself just like you help your patients.
Wow, that was incredible words of wisdom coming from you, Dr. Middleton. I think your wellness phrase there that you snuck in so cleverly should be like a meme, or should be something like a sticky that we put on our computer, so we remember to when we're harping on something to just let it go, like you said, like think about how we can do better and move on, and remember all those good feedback that we have gotten in the past when we're just kind of focused on this one error or setback. So great advice.
I think there are plenty of memes out there for Be a Goldfish. There are t-shirts, you can, whatever calls to you.
Well, that sounds good. I think I should get one for myself. Okay, well, last question is just to get to know more about what you do for your own wellness. You know, with all these hats you juggle, what do you do?
So for me, a lot of what I do revolves around my 11-year-old son. He's very athletic. He's also a musician. We will play together. He plays guitar, I will play drums. And he's a big soccer player, and my biggest hobby is as a sports photographer. So I take pictures of all his games, and I post them for all the families on the team. They love that. They can share them with their relatives and friends, and it's kind of nice to have those memories. So that's how I get a little time away from medicine and enjoy myself.
That is too neat. It sounds like you do a little bit of like orthopedics, like in rheumatology in your work, and then you do sports photography. So you can't get away from that. But
there's kind of a theme there, I guess. I didn't realize that, but
that is really cool. Well, that wraps up our interview. I just want to thank you so much for taking the time to interview with us and share all your pearls with all of us. So I appreciate it, Dr. Middleton. Thank you.
Thank you very much. I'm happy to do it anytime.